Welcome to the presentation of Part 2 of Lecture Metabolic Bone Disease. According to World Health Organization, osteoporosis is diagnosed if T-score is less than or equal -2.5. T-score indicates the number of standard deviations below or above the average peak bone mass in young adults. Why we treat osteoporosis? This means what are goals of therapy? These to prevent first fragility fracture or fracture in future, to stabilize or increase bone mass, to relieve symptoms of fracture and or skeletal deformities, to improve mobility and functional status, and to initiate lifestyle changes regarding smoking and alcohol. Who will be treated? According to National Osteoporosis Foundation Recommendation for Diagnosis, Management and Prevention of Osteoporosis 2013, patients with T-score at femur or spine less than or equal -2.5, patients with T-score at femur or spine between -1 to -2.5, this means osteopenic, whether male or female above age of 50 years, with 10-year fracture risk at hip more than 3%, or for major osteoporotic fractures higher than 20%. Also, patients with fragility fracture, regardless T-score, all these patients must receive treatment for osteoporosis. Starting with non-pharmacological therapy of osteoporosis, it includes having an active lifestyle, stop cigarette smoking, avoid excess alcohol consumption. Regular exercise is one of the best things we can do to prevent osteoporosis. Bones, like muscles, need exercise to stay strong. Moderate exercise 3 to 4 times per week is recommended. Weight-bearing exercise like walking, tennis playing, and low-impact exercise classes are best for building and maintaining strong bones. Nutritional intervention mean to encourage the intake of calcium-rich food like yogurt, cheese, milk, sardine with bones, and green leafy vegetables like broccoli. The recommended calcium and vitamin D intake at different ages are illustrated in this table. Observe the average requirements at ages between 19 to 50 years, between 50 to 70 years, and above 70 years. Also, please observe requirements of both calcium and vitamin D during pregnancy and lactation. According to GB Update in Osteoporosis 2017, lines of drug therapy in osteoporosis are illustrated in this table. Important points regarding different drug modalities will be mentioned in face-to-face session. What is osteomalacia? Osteomalacia is rickets of adult. The main cause is deficiency or resistance to vitamin D or phosphate handling problem. There is defective mineralization of bone. The main complaints are proximal myopathy, bone pain, and malaise. Also, there is bone tenderness, paresthesia, muscle spasm, and there may be signs of hypocalcemia. This table illustrates comparison between osteoporosis and osteomalacia. Please have a look. This X-ray shows radiolucent linear zone of pseudofracture in femur perpendicular to bone cortex in osteomalacia. Treatment of vitamin D deficiency is by giving the patient 50,000 international units of vitamin D2 or D3 once a week for 8 weeks, followed by maintenance therapy of oral intake of vitamin D of 1,500 to 2,000 international units per day. Please be ready with your question in the next face-to-face session. Thank you.